Dementia is not a personal trait, it is a disease. A lot of times, when a person with dementia looks in the mirror, he's confused. He does not know who is looking back. My name is Reggie Matthews. I'm the CEO and owner of Right at Home, Northern Westchester. And today we're going to talk about how to care for someone who has dementia. Close to 60% of our clients, of most agencies' clients, have some form of dementia. And a lot of the dementia patients tend to repeat themselves. And each patient who has dementia is unique in the manifestations of what they go through. A classic example is one of our clients who had dementia, who thought that his wife was still the young bride that he married. And every time he saw his wife, he wouldn't recognize her. And he would look at the young damsel and said, "Is this my wife?" And go out to sort of, hug her. And that is one of the aspects of dementia. Clearly, this client of ours has in his mind a young damsel that he married. So in most interactions, the moment he saw a young woman, he would go out and try to hug her. Clearly, it seems humorous, but it is the facts of life. So here are some steps to help a patient with the dementia. Number one is to communicate effectively. Most of our dementia patients have peripheral vision issues, so you need to talk to the patient very slowly, calmly, and look him in the face. It has to be that one-on-one. Your tone of conversation, you've got to stay calm, you've got to talk softly. And a calm approach will help a patient or a client that has dementia to also stop and listen to you calmly. And that is effective. You've got to treat them like children. Patients, they will tend to sort of ask the questions again and again. So that is important. Communication and how you sort of get across to the client when you're talking to him, that is one of the key aspects of the care that we provide to our clients. The second aspect of home care, number two, is to modify the home for safety. Dementia-proofing the house is so important. Locks in place to prevent the dementia patients from leaving the home and wandering away. They will get lost. 90% of our patients have sundowning. And when the sun comes down, they need a good 7 times the amount of light that we normal people need. So keeping the house well lit is an important aspect. Making sure that the equipment that one uses, ovens, are dementia proof. So that is one big aspect of it. The other big issue is fall risk. Fall risk is a key aspect of dementia patients. People do tend to sort of trip over things, especially when they have vision issues. So go to our website and look at our fall prevention video as to how to sort of help yourself to help your loved ones. Number three, keeping their home in familiar surroundings and around familiar people. One of the aspects of dementia is they have shorter memory losses. So they have to, every time you change the environment in their houses or in places that they live, they get totally confused. The classic example is we had a client of ours who unfortunately had lost her daughter, and she kept her room and the whole house exactly the way the house was when the daughter had passed away. One of our aides had gone into the house and started making changes to it. She became totally perturbed, and we had to step in to say, no, please revert the house to where and how the house was. And that is a key aspect of it. Not being familiar surroundings is very detrimental to a patient who has dementia. And that's one of the things that we try to sort of reinforce with the aids that go in to help dementia patients. And that leads into the next aspect of it. Keeping the client at home is such an important part of dementia care. We found that taking a client out of the home and putting them into a facility that takes care of them, we found that they rapidly deteriorate in their cognitive because of the fact that they are under new surroundings and they find it very difficult to cope. Number four, creating a consistent routine is another aspect of helping dementia patients lead a very normal life. Structure, brings comfort. I will tell you a story that I read about our ex-president Ronald Reagan. He loved cleaning his pool of fallen leaves. So every morning he would go out and clean the leaves. And when the leaves were more or less clean, the Secret Services would dump a few more leaves to keep him active. And that is absolutely important. The routine, getting to do familiar things, is one thing that we found that the clients do absolutely require. Number 5, monitoring health and nutrition. A lot of the dementia patients have no idea where they have had breakfast, lunch, or dinner, or anything in between. So it's important that they have a routine as far as their nutrition goes, making sure that they're eating the right food, taking the right medications, and also having the routine, having breakfast at 9 o'clock or whatever is important, and keeping hydrated. A lot of our clients have UTI. And with UTI, every time a client has UTI, the manifestations of dementia becomes very bad. So it's important that keeping a clear eye and a routine as to their meals and also the hydration is another aspect of the care for our dementia patients. Number 6, engaging in meaningful activities that are specific to them. Every client that we have who have dementia have something that they had done as a hobby or something that they've used to as when they were younger. Like, for class example, they must have played a piano or a guitar or listened to music, watched movies. And that is important, that they revert back to the younger days. So it's, if a client has played music or played a musical instrument, it's important that they try to sort of pick up those rudimentary things that they work. And you find that a lot of our clients who had dementia, who had played a musical instrument, still remember to play those instruments. So it's important that if you can go back and sort of recreate that environment in which they had been living in, they do really do well. Going out for walks. A lot of our clients love, especially the hikers, just going out to nature, or gardening, for example. These are important aspects of something that a client would absolutely love, especially with somebody with dementia. The last thing that we encourage people that have loved ones at home that is suffering to dementia is to hire a home care agency that has specialized experiences and aids that can treat dementia. It's important because they have trained people that have dementia experience, and we also sort of keep them trained for any new nuances or any new studies to how to help a patient with dementia. So it's absolutely important that you talk to a home care agency to find out as to what are the alternatives for care of their loved ones. So to learn more about dementia care and such, go to our website